Hi, this is Dr. Tim Syed, MD, double board certified plastic surgeon. Today I want to talk to you about the digital consultation experience and some of the tools that we use in our practice to help educate patients and help them meet their aesthetic goals with plastic surgery. So as you see here, I've got an iPad, which we commonly will use as part of the consult visit with the patient. And loaded on here is a tool called Chrysalix, which is a body simulation tool that can be used to create 3D models of your face, breast, or other parts of the body that you're seeking plastic surgery to change. This would be an example of a patient seeking a rhinoplasty consult, and the iPad is actually used to scan the patient in multiple angles, and then it computes a 3D model that we can then manipulate. So it's pretty state-of-the-art. It's almost like Hollywood computer graphics where they can really manipulate reality. The goal here is not just to show you any old change or sort of make it look like plastic surgery is magic. It's really about educating the patient, setting realistic goals, and using it as a tool for dialogue between the patient and the surgeon. For example, on this rhinoplasty consultation, we have the 3D model that we scanned in here, and we can rotate this model around and change the view. And then we have a panel of tools that we can use over here to manipulate the image and review those changes with the patient. And we can ask the patient, do you like this degree of change? Is this too much? Is it too little? And see if that matches up to the patient's aesthetic goals. So for example, the top slope of the nose, we can change here with this tool, get extreme, go back and forth and make adjustments. We can rotate the patient's image around and show some of the changes that would occur if we narrow the nose or move the nose left and right. Here is narrowing the nose at the top. Here is narrowing the nose more in the middle. And here is adjusting the tip of the nose and making it more refined. And we can see this in multiple different angles and views, even looking up at the nose and from both sides, and this will really help the patient make an informed choice. So Chrysalix, of course, can be used for other parts of the body, and one of the best use cases is when we do consultations for patients looking for breast augmentation and breast lifting. This tool is really helpful to help give a patient an idea of how the cleavage can change, the appearance of the breast in different angles, different views, and the effect of different size implants and styles of implants and how that can change the appearance and shape of the breasts. So with this tool, we can dial in things like a breast lift. So here I can make adjustments and change the position of the breast from not lifted at all to very lifted, and the patient can get an idea the difference between just doing a breast augmentation or doing a breast augmentation along with a lift. We can also simulate the position of scars, and we can make those scars narrower or wider, reduce the areola. We can show you how the scars can lighten over time. They start out kind of pink and then they get lighter over time. And we can dial in a whole catalog of different implants. We can simulate the implants being above the muscle, below the muscle, the dual plane technique, which is popular. We can also do different things to both breasts. So if one breast is larger or smaller than the other, hangs more than the other, we can make differential changes. For example, we can put a larger implant into a smaller breast to achieve balance. Chrysalix also offers up a whole library of different implant styles and shapes and sizes. So if a patient says, I'm looking for an anatomic or teardrop-shaped implant, or I'm interested in saline, or I'd like to try the new Ideal implant, or I'm interested in the very popular smooth round silicone implants from Mentor, we can select different criteria, narrow down type of implant, and we can see changes in the model depending on which implant we select. We can also place different implants on the two sides. This is an extremely powerful tool for helping educate patients. One of the most commonly asked questions that we see on RealSelf and in email inquiries to our website is, well, how do I select the right implant for me? And we have a whole other video just describing the selection process to help educate our patients through that process. Chrysalix plays a big role in helping to educate the patients to make an informed choice. Another tool that you'll see me use in our plastic surgery consultations is Modernizing Medicine EMA Plastic Surgery, which is the electronic medical assistant. It's actually a medical record where we'll keep all of your clinical notes and records of communications with the patient and exam findings and so on. But we can also use this to educate our patients and do diagrams, both drawing on the patient's own photos, but also on standard anatomic atlas images that are taken from a large library of images. So I can explain to a patient visually how we're going to perform a breast augmentation. For example, I can explain where the incisions might go and kind of try to make them flesh tone, give the patient somewhat realistic expectations of where incisions might go under the breast or around the edge of the breast. I can also explain how a lift would be performed and where the incisions can be expected. So an incision around the areola here, sometimes a vertical lollipop approach, or in patients with much more sagging of the breast, an approach where there's also incision in the fold underneath the breast. This again is very powerful for educating patients, and we can furnish copies of these images digitally to the patient to review with loved ones after the consult, and they can come back to us with additional questions. Another thing we can do using emoplastic surgery on the iPad is diagram out where the implant will sit with a breast augmentation and explain the difference between breasts that have a lot of hang and might need a lift versus patients who don't need a lift and can get by with augmentation alone. So I can show them the difference between a breast that has extra overhang versus a breast that is perkier here, and show them how we can move from here to here by placing an implant behind their muscle, the muscle sitting over the implant like this, and their breast tissue then sitting in front of all of that, with the nipple having been lifted from down here to up there. And we can save this image and again furnish it to the patient. We can add text and arrows and so on and really create a nicely annotated educational illustration. Emoplastic surgery has an assortment of images for different body parts, including views inside the nose, of the cartilage, and this can really help us diagram where we would put stitches, how we would reshape the cartilage in a rhinoplasty. And we have a number of other different views. If we're seeing a patient or we're treating the nasal fracture, or I want to explain what I will do to the nasal bones during a rhinoplasty, I can illustrate this on this image. We can show an approach to doing eyelid surgery on the two eyes. Anything you can think of, we can pretty much draw in this tool and help educate you about the procedure. That's just a brief overview of a couple of the different digital tools that we use as part of the consult experience, and I'm proud to say that I've had a role in helping to develop some of these products with the companies, and we're constantly working to help refine them and improve our ability to educate patients and help them make really good, informed choices for plastic surgery. We really look forward to the opportunity to provide you a consultation, and you can learn more at our website, timsyedmd.com.